Australia enjoys one of the highest life expectancies in the world, at around 82 years of age for males and females combined. But did you know that Aboriginal people experience a life expectancy of around 8 years less than non-Aboriginal counterparts? That's bad, particularly if you're an Aboriginal person. How would you feel if someone were to say to you, you and all your family are going to die 8 years earlier? You might ask, why is this the case and what can we do about this? Well, Aboriginal people have, put simply, lower levels of access to what we refer to as the social determinants of health, which are the factors that shape and influence the way we are born, we live, and we age. Historically, Aboriginal children have attained lower levels of numeracy and literacy. The reasons are complex, but high levels of ear disease and hearing loss play a large part in the delay. Work funded by the Telethon Foundation here in Western Australia have shown that Aboriginal children have some of the highest rates of ear disease in the world. The effect of 3 years hearing loss in early childhood can have lifelong impacts on one's prospects. In Western Australia, the ears of Aboriginal children are checked around every 6 months from the day they are born through to around 5 years of age. The checkup involves a clinician asking the parents whether they believe there's any ear disease or hearing problems with the child, and then they examine the outer ear and look at the eardrum.
But we're stopping short. We need to be assessing the middle ear. Sometimes bacteria and fluids build up behind the eardrum. This condition is called otitis media with effusion, or colloquially, glue ear. There's a tool we can use for this. It's called a tympanometer, but unfortunately it's not a standard step in the examination. Glue ear is difficult to detect visually, and it can be enduring and often comes back. Hearing tests are difficult in young children, and a key benefit of tympanometry is it can be conducted on infants as young as 6 months of age.
The aim of the research is to test the accuracy of the clinician in diagnosing glue ear with or without the tympanometer. The project involves recruiting Aboriginal children to be screened, as well as Aboriginal health workers to do the screening. The Aboriginal medical services, the schools and the sports clubs have all indicated their enthusiasm for the project and a great way of raising awareness of the issue. The way it will work will be that the clinicians will talk with the parents and the children, assess the ear using traditional techniques, and then they'll record their assessment. They will then be given a tympanometer and they'll make a second assessment with that, and they'll be given the opportunity to revise their original diagnosis. Ultimately, the results will be shared with the Aboriginal community and published in a scientific journal. The key outcome, therefore, of this study is to show that there is a better way in conducting ear health assessments, and hopefully use these outcomes of the study to influence healthcare policy. Lottery West and the Minderoo Foundation have agreed to match the funding we'll ultimately obtain, but we need to secure the initial grant to cover the costs of setting up our small team at the university and mobilising our partners at the Aboriginal Medical Services to start actively recruiting participants. Glue ear is an insidious disease with the potential for lifelong impacts, but with better testing, we get more opportunity to intervene in those early years when it matters the most. Thank you. Calm down. Calm down.